And this raises the point, is because I know that oftentimes politicians are very sensitive to public perception, and they probably wouldn't have made that decision if they thought there would be significant public outcry. And this is really the interesting bit that I'm trying to understand. And that's what the heading is about. Why doesn't the vaccinated population, which is the majority in the Western countries, want to know? Why are they not pushing this? This is really important.
Sorry, Christian. No, I was going to say, I think if individuals don't want to know, and then their government tells them there's nothing to look at here, don't worry, that reassures them. Oh, the government said there's nothing to. So we go round in a circle, really, of everybody in the same place, using these same techniques of disbelief, denial, and not wanting to rock the boat. So we reassure each other that there's nothing to see here. Let's move on.
And I think if you compare 2020, the government were telling us, this is bad, this is bad, this is bad. So the public wanted the government to do something. And, I always go back to, in the UK, Boris Johnson was dad and the NHS was mum. And so we looked at the parental figures for some help. We didn't know what was going on. So lock us down, Boris, people were saying. I remember people saying, do something. And it was because we were being stirred up into a frenzy by the use of fear. And this time, it's quite the opposite. There's not really discussion about the excess deaths. You see it a little bit, but you don't see a daily tally scrolling across your screen. You don't see the interviews happening all the time. So the public then think, it's not really anything to worry about. So I do think that comparing 2020 to today is really important, because you've got, on one hand, be very afraid. Today, it's not a problem. We're not talking about it. So the public then don't demand something from the parental figures to do something. That, to me, was happening. I think if every newspaper and were talking about excess deaths, and I think that if we were having daily briefings about excess deaths, I think the public would be saying to their MPs, we want you to investigate this, and it would happen. But because there's, we're not seeing that media feed about being afraid, people aren't really aware that it's a problem. So I think that the majority of the people do not really understand the severity, or not that they don't understand, I take that back, they're just not aware of what is going on. They might see a headline, but then another headline pops up, and we're very much about headlines, and we get distracted very quickly because we're living in this information era now where it's another thing. And so excess deaths are only talked to us very, very infrequently in the media.
Yeah, and you raise an important point here then, because if you actually look at the excess deaths, so say, for instance, in the UK, I think in the third week of April, it was 22% above the 5-year average, which is huge, in that week. And now, in reality, we're running excess deaths that are probably higher than what we were getting through most of the pandemic. But you're right, it's not on the news. And so therefore, we don't have that daily, 1,000 people died today, and so therefore, people seem to genuinely not be aware. Who is responsible for that?
I think it's the media. I think the media, if it was fair, the media would be reporting on excess deaths regardless. So if we've got excess deaths in 2020, they were reporting on it. They're not reporting on it now. What is the agenda behind that? Why? Some of us will probably have a good idea about what they think that is going on. But I think that it's the disproportionate reporting that happens here. We have, are the media told what to report is probably my question. That are they actually independent now, or are they captured? I don't know, but it makes me really ask those questions. Why do you not want to report on this where you wanted to report on that? Is it because they're being told we don't want the public to tell us to investigate? So whose responsibility? it's the government and the media, I would have thought, and the doctors who are seeing this. I would say that they should also be speaking up.
And I'll let you say something, Jane, before I say something about with regards to the health practitioners. Any thoughts on that, Jane?
I think all of us are only aware of what we're, most people don't bother to dig beneath the surface. One of the things I'm going to cover at the Better Way conference is that one of the steps of problem solving is to explore more deeply. And most of us don't do that. We operate very much on the surface. Here's the information I've seen or been given. I don't question it. I don't dig deeper. I don't explore. And I think that exploration and taking personal responsibility for that too is not something we are used to. We're not taught these skills at school, how to solve problems, how to resolve conflict, how to understand critical thinking, basically. I mean, this is critical thinking, and we are not encouraged to be critical thinkers at any level. I don't find it necessarily in organizations or in individuals or at government level. That isn't something that we are encouraged to or taught how to practice.
Yeah, I'd just like to say, certainly from a clinical perspective, I think that most of the health service practitioners will know that you can sense it, you can feel it, but most people genuinely still think that it's all COVID related. And now there's certainly some aspect of that because we know that circulating virus and so on. But I have found that genuinely, most people, if you just say it's lockdowns and people haven't been seeing their doctors and the COVID, the majority of people seem to accept that as a reasonable explanation, and they would not think beyond that. That's not unreasonable, is it?
I guess that's an easy to accept explanation, Philip, and I'm interested that you say that that's where many doctors would be at too. And I suppose I come back to the point I was making. And do we just accept things at the surface level, or do we say, I'm curious, I'm wondering if there's more to this. I'd like to know. We don't explore more deeply to say, could there be something else? And why is it, or why might it be important to explore more deeply? And I know you have some answers to that, in that we actually need to know the answer to that question to be able to mitigate future harms. If we don't know the answer, how do we know what the solution to the problem is? We're just sitting waiting to see what happens next, rather than exploring more deeply and saying, we've uncovered some answers.